Welcome to Addressing Race-Based Stress and Mental Health Outcomes for Children of Color. My name is Kristen Pierce-Freaky. I'm the Executive Director of the Austin Child Guidance Center, and I'm going to be moderating tonight's event. I really want to thank you all for coming and joining us tonight. We're delighted, truly, that so many people have registered to join us for this really important topic. This is actually the latest in what's become a series of related conversations about race and racism and their various impacts on children, teens, and families of all races. This discussion was born out of a response to the social unrest and increased awareness of violence, inequality, and injustices that we witnessed in real time over the summer. One of our core values at ACGC is to provide a safe, equitable, and welcoming space for children and their families. And in doing so, we are also called to confront systemic barriers to mental health, discrimination, and economic injustice in our community. For those of you who are unfamiliar with the Austin Child Guidance Center, we are an established Austin nonprofit that has been dedicated to providing accessible, high-quality, trauma-informed mental health services to children and their families for the last 70 years. Roughly 80% of our clients live at or below 200% of the federal poverty level and are often uninsured or underinsured, especially for mental health services. We believe that all children should have equal access to the very best care available and lead lives that empower them to thrive. So for ACGC, we view excellent care as one that takes a team approach to meeting the needs of individuals, of every individual child. So that involves a team of highly trained, experienced social workers, therapists, psychologists, and a consulting psychiatrist, along with case managers who provide a range of services. Our clinical team provides individual, family, and group therapy, psychological assessments, consultations, and medication management. We also have parent and community workshops, and to our knowledge, we are the only walk-in clinic walk-in mental health clinic for children in Central Texas. And I really couldn't be more proud of the work that we do for our clients and their families. We are currently offering all of our services via teletherapy, and we look forward to resuming in-person services in addition to continuing our virtual visits for families who maybe can't drive into Austin as soon as it is safe to do so. So that concludes my commercial for ACGC. A few housekeeping items. Again, just keeping your microphone and your cameras off. This presentation will be recorded and it will be on our website and probably another by Monday. So if you'd like to look at it or you know someone else who'd like to watch it, please keep a lookout for that. The chat box will be open for you to ask questions and engage with other participants. You can feel free to post resources or relevant information in the chat box. We will also kind of distribute those resources on our website next week. Please keep questions related to the topic at hand. So this is not a political debate. So we're just sort of talking about mental health implications. Each of us comes to this discussion with different perspectives, experiences, comfort levels, and knowledge about this topic. So we ask that you be respectful of those who may not be in the same place that you are. We acknowledge that this is a challenging topic and may make some people uncomfortable, but we feel like that can be necessary sometimes to make space for real conversations to occur. And finally, we ask you to refrain from posting any unkind comments or abusive language towards other participants. And with that out of the way, we can introduce our panelists. Each of them comes with a deep knowledge, commitment, and passion for children, families, and advocating for ways our society can better address race and race-based issues. So first, we have Dr. Kimberly Burdine, whose pronouns are she, her, and hers. She is a champion for equity and justice and mental health for Black, Indigenous people of color. She is a practicing and licensed psychologist based in Dallas, Texas. She earned her doctorate of philosophy and counseling psychology from Oklahoma State University, as well as a master's of science in counseling. Her undergraduate studies include a Bachelor of Science degree in mathematics education from Langston University, a historically Black university in Oklahoma. Next, we have Jeannie Nelson, who is the director of the Best Single Source Plus program, a collaborative of 12 organizations led by Caritas of Austin. She is committed to helping families achieve housing stability and preventing homelessness in Austin Travis County. Jeannie received her BA from University of Texas at Brownville with a BA in Applied Technology, Health Sciences Technology. She is keenly committed to raising resilient, empathic, socially conscious children. Next, we have TJ Owens. He is the program manager and facility director of the African American Cultural and Heritage Facility, which is part of the City of Austin Cultural Arts Department. He has worked tirelessly with various commission boards, universities, and advocacy groups to engage the Austin community via strategic partnerships that spur creativity and economic empowerment. TJ holds 2 bachelor's degrees in business administration and marketing and in management from Prairie View A&M University. Finally, we have Tamika Thompson, who is a therapist in the infant and early childhood program at ACGC. Many of her clients are children who are dealing with social anxiety, internal and external stressors, family conflict, and mental health disorders. As a therapist and mother, Tamika understands and sympathizes with the struggles of discussing racism and discrimination with children. However, with over 15 years of experience in the mental health field, she has a history of building everlasting bonds between children and their parents. Before working at ACGC, Tamika spent many years working as a caseworker, director, and licensed professional counselor. She has found her cornerstone with building relationships in the community that bring awareness to people from all walks of life. So now I'm going to introduce our first topic. For children and families of color, stress and race-based mental health issues are not really new. Pre-pandemic studies have shown increased levels of stress compared to their white peers. We also know that race-based stress, like any prolonged stress response, can manifest into toxic stress or trauma, which has negative long-term effects on the overall health of children and adolescents. Race-based stressors combined with the appearance of COVID, the intense and violent social unrest we witnessed, and the political tensions of a memorable election year make it even more important to address the mental health impacts on children and their family at this time. So there's a lot to consider and discuss in regards to this topic, and we're definitely not going to cover it all tonight. But I'm going to ask Dr. Burdine to set the stage for our conversation. Dr. Burdine, can you set the stage by helping us to understand the terminology we'll be using tonight? As an example, what is race-based trauma? What does the term microaggression mean and look like? And how can we better understand implicit bias and other behaviors that cause harm to children of color that we should consider? That was a mouthful, but.
Yes, and thank you for the introductions and for just the opportunity to come together. I think even as a way to set the stage, just recognizing the ways that this topic, though maybe everyone here has some commitment and understanding of the ways that it is important, in and of itself, beginning to have a conversation around our racialized experiences is going to be stressful. There might be some ways that folks might experience stress and trauma even in the course of the conversation. And just want to invite folks to care for themselves in whatever ways, feel good for you in the conversation. But our lives are oftentimes racialized, and particularly for folks who were reared or brought up or grew up in the United States in particular, our systems are, racialized in that we have been socialized to think about race and in many ways that are implicit, right? Or in ways that we don't even recognize. It can be outside of our consciousness. So I think it's important to set the stage to understand that most of our experiences, the way we think about things, the way we view the world, the way that we encounter people are racialized, and we've been socialized that way, whether we wanted it or not, or whether we, agreed with some of the ways that we were socialized. It is a part of our experience, particularly in the US. And you oftentimes hear people who come from other countries and are now living here, they'll talk about how sometimes the socialization here can be totally different. And maybe for the first time feeling racialized or having people that encounter them connected to their racial identity. So if we begin to imagine that, right, if our worlds are, if we've been socialized around to think about race and to not think about race, right? We can be socialized in different ways. That means that the reality of the potential for race-based stress and trauma is that much more possible and heightened, and depending on the socio-political climate and what's happening with us, and even now in our more our global worlds, right? And we have the internet now, and so a lot of things, we can get exposed to things in very quickly and in very viral ways. And so our exposure to race-based stress and trauma can be, pretty regular. And so trauma, just like any other trauma, the way when we're thinking about race-based stress and trauma, we're talking about the ways that we experience the physical and psychological symptoms after exposure to some sort of traumatic event. And we're thinking about trauma, we're thinking about something that is life-threatening. If we think about like racism along with any other thing, we know now that oftentimes is life-threatening and can be life-threatening depending on the circumstance. So our symptoms associated with trauma can be fear, hypervigilance, shifts in our mood, thinking about, just confusion or anger or shame and guilt. Headaches, there can be like the physiological symptoms, headaches, difficulty sleeping, self-blame, impacts around memories. So just like in the way that we experience other kinds of trauma, race-based stress and trauma can manifest in the same ways. And so without doing, a whole dissertation on race-based stress and trauma, it is important to think about the ways that then it becomes intergenerational. So we all experience it in different ways depending on our generation. So especially when we're talking about families and kids, kids are going to be experiencing that one way that might be totally different than the way that their caregivers or other people around them have experienced. And there's oftentimes a historical layer. So for race-based stress and trauma, different from other traumas, there are layers and layers of it that there's a historical context. So for folks who are Native or Indigenous, and particularly African-American folks, there is this historical context too. So when we experience something that is racialized, oftentimes it is not in a vacuum. It is cumulative, and we are recalled to all of these other historical accounts. And so in the current climate that you talked about, Kristen, right now, we can imagine then that there are a lot of ways that race-based stress and trauma is heightened because of the pandemic and the health disparity and implications for people of color. And then also with the ways that just xenophobia, and I think about like our Asian and Asian American and Pacific Islander communities are experiencing anti-Asian sentiment because of the way that people are talking about the virus, for example. So it definitely shows up. And then with other layers of identity, let's say for, a person who identifies as Black, Indigenous, or person of color and queer, or a part of, the LGBT community, or a part of disability community, all of those things come together to create an even more, stressful and traumatic experience. And oftentimes these things are not even in our awareness. So things like implicit bias can show up. And because they're happening so regularly and in very, sometimes unnoticeable ways, that's where we get the term microaggression from, in that they can show up. So I'm going to stop talking because obviously that's what we're going to, kind of get in the meat of today, but wanted to kind of provide as rich as possible of a foundation for our discussion.
Before we do, I just want to, could you give a couple examples of microaggression just for people just to have some specific concrete examples?
Yes. So, and thinking specifically about, kids and some of their experience, oftentimes they're in classroom settings or in school environments. And I think something as, seemingly small as I'm oftentimes, maybe told that I am articulate, right? And so people might even be thinking that like right now, and the ways that what that can communicate and how I can experience that as a racialized person is that maybe you don't expect me to be. And the ways that that can be connected to my race, it can be connected to my gender. But I think something like that can be an example of a microaggression. And micro in that oftentimes people's intention is not necessarily to aggress or to be aggressive or to be harmful, but the impact of it for me and my racialized experience, and maybe the ways that I'm taught that, people have maybe lowered expectations of me because of my race. Then when someone says something like that, then it can contribute to that feeling of that stress. It's another layer of that stress and trauma that I might experience. And oftentimes these things are happening maybe 5 times in a day. Then that's going to be even more impactful. So maybe one isolated incident, but I'm connecting it to all of these other experiences that I might have. And I think it can also show up in the ways that sometimes we can be fearful of certain, I think Black men's experience oftentimes. I think oftentimes people can frame them as, threatening or that sort of thing. So maybe when you are interacting with a person, or maybe you walk down the street and you're walking past, a Black man or somebody that you read as a Black man, then doing things to kind of like, clutching your purse, for example, or moving to the other side of, the walkway. It can be things as minor as that, and certainly, or minor, but would definitely open up to the rest of our panelists to talk about that too. But those are some of the examples that come to the top of my mind.
Thank you. So just talking a little bit more about the mental health issues, especially those related to children of color. Tamika, I want to direct this next question to you. What are some of the unique mental health issues and stressors facing children of color, and what makes those different from stressors that Caucasian children or other children face?
Yes, definitely. So great question. Children of color are facing many issues right now. And one in particular that I want to piggyback on Dr. Bedine is, the mental health component. They're facing trauma, violence, oppression, racism, and that plays a huge role in the African American community. And it stems from what the mental health services provide or lack thereof. Sometimes there's not access to the resources that they need. Sometimes there's misdiagnosis in the schools, or presumption of having a diagnosis within the school. And that plays a big factor on especially our African American young males not being heard, being dismissed about what you're feeling, what's being said, what you're going through at school. So that dismissal piece, constant exposure to discrimination, like what Dr. Bedine said, the microaggressions, making little comments here and there. Those things add up over time. So they're experiencing those things not only in the community, but at a school that's supposed to be a safe place for them. Violence in the home, police brutality. We're seeing it portrayed all over the media right now. This is not something new. It's been going on for years, 400 years. It's just more in front of us. It's on TV. Our kids are looking it up on YouTube. They're it's in their face constantly all day. Possibly family members being undiagnosed. Those are some of the things that, children of color are experiencing. They're looking at an uncle or an aunt or a mom or dad and like, what's going on with them? And they're just not understanding those roles, having maybe little to no food. And that plays a big part in COVID right now. They're going to school to get their meals, to get lunch, snack, and dinner. Now they're at home all the time, not being able to get the meals that they need, not being able to get some type of support that they need. Also, undiagnosed mental health concerns. So when I say undiagnosed, yep, sorry. So when I say undiagnosed, so you talked about a little earlier, you have an uncle that is going through something and they're just not really sure. So in the Black community, Hispanic community, we do somatic symptoms. We don't go in there and say, hey, I think I'm depressed. Hey, I think I have anxiety. Hey, I think something is going on with me. We talk about somatic symptoms, physical symptoms. And to speak to a little bit of what Dr. Burdine said earlier is, having headaches, their stomachs in knots all the time, just feeling uneasy, just hyper vigilant all the time. That's how we represent what is going on with us instead of labeling in it. So those are some of the things that, we're experiencing. So when you have someone that's possibly undiagnosed in the family and you say, hey, there's a lot going on at school, maybe I should reach out for help. And then you're seeing like, this happened to my uncle. He was going through some stuff, and instead of him going to the hospital, he went to jail, so you're seeing this man in your life being taken off in handcuffs because of something that's undiagnosed that he should have been in the hospital for instead of going to jail. So why, you ask that question, why do you reach out for support? Why would I ask for support if this is going to happen to me? You have to look at those things. Those are the things that they're experiencing. Some of the stressors, unfortunately, racial stress, it's built up a lack of trust, unfortunately for, white America, as they're looking at us different, we're looking at them with caution. They're looking at him like, what are they going to say? What are they going to do? Am I doing anything wrong? So they're being very cautious of those things. So when they are experiencing some mental health, they don't want to ask for help. So how do we support them in asking for some type of help within the school, like I say, or within the community? Feeling insecure about themselves for some of the stressors that they're going through, not being able to connect with their friends that possibly look like them in the schools. So, those things have been taken away due to the pandemic as well. The body responses, the fight or flight, if I'm approached by somebody, what do? Do I stay there? Do I run? What's going on? So we have all these things going on in our head on top of possibly a mental health concern. That's a lot for anybody to go through, especially a child of color. Minimizing their some of the things. I've dealt with a lot of kids that, they approach me and they say, hey, my teacher was talking about this and I was trying to explain something to them and they're like, oh, that's not a big deal, or just brush it off and stuff like that. So what do you do when you don't have that support? What do you do? Stressors from possibly hearing parents fight due to loss of jobs, due to not having income. So those are the things, the isolation, not being able to be out in the community, profiling. That is one of the things that are highlighted right now for children of color, is being profiled. So Kristen had talked about, some of the differences between a person or a child of color versus a white child, and this is it can be an uncomfortable conversation, but we need to have that conversation because there are differences that, and there are things that people notice just because of the color of their skin. So you'll have a white child walking down the street. They're not going to get pulled over. They're not going to get stopped. They don't have that fear of, if I do get stopped, I might get shot. Or if I do get stopped, I might go to jail. The young Black males especially have that fear of, what do I do? Do I keep my hands in my pocket? Do I take my hands out of my pocket? Do I take my hoodie off? am I moving too fast? Those fears. We also have to realize the colors of, the shirts. Some of you guys are thinking like, okay, oh, my child wears this red shirt, red pants, not a big deal. White child, it's okay. A Black child wearing that is quickly labeled as a gang member. If they're wearing red or if they're wearing blue, they have to worry about things like that. So you wouldn't think they should have to worry about those things, but it's compiled. It's compiled with all the stuff that's glorified in the media, all the things that they have to experience at school, all the things that are going on in their home life. Who can keep up with that? It's just a lot. So those are just some of the small, not small, bigger, it's big impact, in the mental health and the stressors that especially children of color go through. But it's something important to look at, something, and I appreciate this panel and people taking the step to saying, hey, I want to open up this conversation. I want to talk to somebody about the things that I do know and the things that I'm not aware of and stuff. And how do we work together to build to support for our children of color?
Thank you, Tamika. TJ, you've been really active in the community in roles that have allowed you to see firsthand the impact of race on children of color as well. How have you seen race impact the mental health of children and teens that you work with? And what impact have the unique events of 2020 had on the children and teens that you've engaged with?
Well, I would say, I think when you think about everything that's happened as of late, I think one thing that stood out that's kind of rang true in everyone's answer so far, we've all talked about the transmission of information now, right? And the reason why I bring that point up is now some of these more personal incidents that may happen on maybe on an institutional racism level, or even just on a personal racism level. Now you have instances where you can identify what is happening with other people that look like you all throughout the United States, and really even in other parts of the world, right? So it's not just personal to you anymore. Now you have other people that are going through the same thing, and you don't feel like this is something that just happened to me. It's very easy to try to suppress a negative experience if it just happened to you, right? But when you know what's happening to other people who look just like you every day, it has an effect that is cumulative over time, and that's conditioning also, right? What do we put in front of ourselves? How do we interpret the information that's put before us? These are all very, very, very important variables. Also, one thing that's huge when you think about kids and just some of the conditioning around racism, you think about the technology and the information divide, right? Often when we talk about history, the perspective is really not a part of that conversation, right? We don't really have a chance to really steer the narratives and talk about our place and our voice within history. And that's a big part of what I do at the African American Culture and Heritage Facility, is to include that voice and do it in a way that is very identifiable by using, factual instances throughout Austin's history. So having candid conversations about the 1928 city plan, having conversations about people like Heman Sweat, or maybe even William Astor Kirk. Just as many of those negative instances and narratives that we see out there, we need to be able to show that people have worked within this system that was created to have roadblocks institutionally. And when I say that, meaning that it's not even that other person's fault that may be enforcing some of these barriers of oppression. And you still are able to kind of work within the confines of that system and be successful. So, and I think to kind of go back talking about the information and technology divide, that even has generational repercussions. How can we expect a child that's in elementary school, middle school, or high school to know how to navigate in this new virtual environment if their parents do not even know how to use a laptop or a calculator for that matter? So, these are the things when we talk about resources, support, equity in the allocation of resources and support as it relates to kids across the spectrum. And I think really to look at it beyond across the spectrum is that we need to approach it with a high level of equity, meaning that we need to have concentrated density of funds and resources that are going to people that need it, and acknowledging that historical marginalization over time.
Thank you, TJ. We had a comment from one of our participants who said that they would love some suggestions on how to advocate for children of color in the school system. This person's children are considered the problem kids without taking into consideration some of the comments that Tamika had mentioned about some of the stressors that kids are dealing with. This person is saying they would like a good relationship with the school, but feel that their children are being classified and judged and not really being heard. So I'm going to address this to any of the panelists who want to jump in.
For a hot second, I was a high school teacher and a school counselor, and I was starting to type a response to this question in the chat, and just want to validate, because that was one of the examples or thoughts that came into my mind as well, in terms of how we are socialized, and more importantly, how white folks are socialized to think about our kids, and to think about specifically, our, Black and brown kids. And so I want to just validate that is very real in terms of how we are, kind of socialized. I would encourage folks to think about, is to try to find just partnership. And I think very strongly about collaboration, and because I'm thinking about you and wanting to make sure that you build in for yourself some protections as well. So if you can identify if there is some person in that school, or maybe even the school district, that you feel a sense of safety with, or maybe you've interacted with them and you had a positive experience, maybe linking up with them to get some inside scoop into what might be the pathways that are the safest for you. Because I then think about, and this is just the reality, right? The harsh reality of, we have to be protective of our kids. We can't go in and, just kind of, I think it can be helpful to have a strategy, right? In order to protect yourself and protect the kids. But I thought of, if you can think of maybe a former teacher that they had that was really, impactful, that you can partner with, that can maybe even become an advocate with you, not necessarily for you, but with you. I think that was one of the first things that came into my mind. Can you get a co-conspirator, somebody that can kind of have your back, and that's already in the system? Because these systems are really powerful, and it can be very scary. And just shout outs to you and the ways that you're thinking about how to support your kids. It's very difficult.
Yeah.
Thank you. One of the hopes of this panel discussion is that people feel better equipped to continue to learn about race and racism in our society, and how we can empower all children to thrive. Jeannie is a longtime community member, nonprofit leader, and mother of adult children. I'd like to ask you to start our conversation about how families, schools, and communities can be allies for children of color.
Kristen. So I'm going to acknowledge that I'm not an expert at this, but I have some personal experiences that I'd like to speak from. And so when we talk about communities and schools, I want to break that apart from families just a little bit, but knowing that many of the concepts would apply to our families as well. And I think one of the biggest things that I've come to realize is that if we're going to raise children who are allies and promote allyship in our communities, we have to be allies. And so I think we start by figuring out how we do that. And for me, the beginning was to normalize conversations about race, to be able to have those tough conversations, and not to just be able to have reactive conversations to what's going on in the world around us, but to be able to have conversations when there's not something in the news, because racism exists whether we are seeing it in the news or not. And so it's important to me to be able to acknowledge that those conversations are uncomfortable. And it was very important for me to learn that being good at having the conversations or being perfect at the conversations was just not going to happen. And human nature is we don't like to do things we're not good at. But if we're going to make progress in this area, we've just got to get comfortable with not being good at this. and realizing that we have biases and we being comfortable with being called out sometimes. I think another thing that we really need to do is educate ourselves, and there's no reason we can't right now. I Google one Google search will open a world of information to help educate ourselves and to help educate our children. Learning the terminology, what is racism, what is anti-racism, understanding that anti-racism and not being racist aren't the same things. What are microaggressions? So we've touched on some of that information earlier in this conversation. And there are lots of books out there, and probably the one that everybody heard about first was White Fragility, but there are many other resources. Me and White Supremacy, How to Be an Anti-Racist, The New Jim Crow. Do a Google search and read some of those things from different perspectives. And often there are resources, age-appropriate resources attached to the adult resources that we can introduce these concepts to our children as well. TJ touched a little bit about learning the history in our, how has this affected our world, the world that we live in, our country, and then how does racism touch our local community? And one of the first things that I was really surprised to learn when I started to learn about the history of Austin was the 1928 city plan, which basically created what we know as the I-35 East-West divide that became kind of the divide between justice and injustice, the abundance of food and food deserts, health care and lack of health care, everything that is touching the world of our children and adding to the stressors for children of color. A lot of that can be correlated to things that have happened in history, and we don't learn these things in school. I didn't learn them in school. I didn't learn them in college. I didn't learn them till I was an adult and I went looking to understand. And then I think that we can get involved with anti-racist organizing. The City of Austin's Equity Office is a good place to start. They have an equity action team that anyone can join. Austin Justice Coalition. There are a lot of good local organizations that can help us get involved in anti-racist organizing, which will lead us to learn about public policy, school board policy, the charters, bylaws, rules of groups we belong to. And once we start to look at those things through an equity lens that we've learned about because we've educated ourselves, then we can start to figure out how we go forward and actually do anti-racist work. And for me, once I started to be able to identify the things that I didn't see before, that was when I wanted to take action. And one of the first things that I learned was that was when I needed to stop and pay attention and listen for a while. And I needed to learn to take my cues from the people most affected by those issues. So that's one of the big things. Absolutely, as white people, we have a responsibility to do this work, but we need to do this work in a way that is going to be most effective for the people who are affected by racism. So I don't want to expect people of color to do the work for me, but I do want to take my cues. And then I said I'd touch on families, and all of what I've said, certainly we can take into the conversations with our families. And by doing this, we've set an example for our children. And that's been the most important thing for me. I do have 2 grown children, and I would do a lot of things differently now than I did when my 25 and 26-year-old children were younger. I always wanted them to learn about things from me at home before they learned them out in the community. And I would say that one of the things that I was not great at really was having direct conversations around race. I learned as a child and perpetuated to my children color blindness. Well, that doesn't work. We are different. And I think that recognizing those differences and recognizing how those differences make our experiences very different is important in teaching our children what they need to be allies. We have a completely different set of tools and a language that we can apply to our conversations with our children now. I would have started young with my children. There are studies that show that starting very with young with children and having conversations around race is effective. And I would have been more intentional in my conversations. Again, just being very direct in addressing the differences, versus using terms like being kind to our neighbors and respecting our differences. I would have actually talked about those differences and how they actually affected my children's friends who were children of color, and how their experiences were different, and how they could, how they could then call out some of those injustices that they see, and be allies and be a support. So again, not an expert. These are just my experiences, mostly as a parent, and me making my way through learning, which is going to go on for most of us forever. This is not something we can stop talking about at any point, because when we stop talking about it is when we really stop moving forward in a positive direction.
Thank you, Jeannie. We have a couple of questions in the chat, so I wanted to get to some of those. One was, and this is for any panelists, so are mental health issues more stigmatized in communities of color?
Yes. I think it really ties in directly to what Jeannie was just speaking to, when she was saying that she wished she would have done a better job at speaking, speaking about race early on. Within my home, and I'm sure a lot of folks that identify as Black or African American, we had no choice but to talk about race from the very beginning. And the way that you talk about it is you take it from a standpoint of trying to eliminate it by trying to be above it, right? So, and what I mean by that is from the onset, I was always told, be twice as good, be twice as fast, do whatever you need to do 2 or 3 times better than the person that's sitting next to you. Right? 9 times out of 10, knowing that that person would not look like me. So, it's great to hear that perspective of saying, hey, we need to talk about these issues with kids early on, but I also want to bring up, when you talk about equity, the folks that are on the opposite end of the spectrum have no choice but to talk about it because it's such a huge part of their everyday life.
So given that, do you feel like the issue around stigma is sort of within communities of colors is really just a different way of thinking about it or talking about it? Or do you think it's that there's shame or different feelings around mental health as it relates to experiences of racism, or just as it relates to other things that come up in terms of mental health concerns?
For sure. I think one thing we're really talking about is vulnerability. Right? Vulnerability and really owning your feelings emotionally, no matter what age you are. And I think that sometimes the way that we are taught to address it early on is the way that we try to even do it as adults. And it doesn't work, right? So we have to be candid enough to be able to identify where we are and really truly owning those feelings, and being able to have some of those conversations, and rather than taking the approach of saying, okay, the way that I beat this is by trying to be above it or to act as if it isn't there, right? It's just acknowledging that. I think that's super important.
Another question in the chat is from a person who says, what strategies do you have for a middle school girl to decrease her anxiety after a situation where microaggressions were exercised by a teacher, and the parent, I guess her parent, spoke with the teacher about the issue, but now the child's anxiety is very high, and she doesn't really want to speak or attend class or actively participate in the class anymore with this teacher? Anyone?
I'll add on to that. I think first is validating the little one's concern, taking a step into maybe having a sit down meeting, because this is something that is important. She's feeling some anxiety, she's feeling some nervousness from whatever was said in the classroom. So I'm pretty sure the other students in the classroom were picking up on that, her feelings of nervousness, and the teacher probably is as well. But, some of the teachers are taught to kind of ignore that. If it's not brought to my attention, I'm going to ignore it or kind of put it on the back burner. So my thought is to have a sit down meeting with the daughter, and see, hey, say, this is what's I want to do, I want to support you. And how would you want that to look? And getting her point of view on that, and then having a meeting with the teacher, and see if the teacher is responsive to the concerns of the daughter. If not, me as a Black mom, I take it to the next step. Like, this is my kid, and she's feeling a certain type of way. So we got to get a solution to this. If we're not able to find a solution, then, we need to sit down with the counselor. We need to sit down with possibly the principal and say, hey, this is what's going on. Whether it was intentional or unintentional, this is what she's feeling. And we have to validate her feelings.
Thank you, Tamika. Another question in the chat was, when will the mental health system begin to address white pathology and its impact in white families? If there is an oppressed, then there is an oppressor, but we never talk about that when it comes to racism.
Definitely think, and I was gonna, I'll post the name of this so that folks can look into it. I think that is part of the way that I talked about, like, that we're all socialized in that way. And I think that is an important part of the discussion that needs to happen in terms of where we are in the process, and there, for white folks to better understand racism and the ways that they have been socialized. And so a great tool, and I will put it in the chat, but there's a book called My Grandmother's Hands. And it talks specifically about, and especially from the lens of mental health and trauma, but it just explains our racialized experiences. And I think it's a great read for anyone and for everyone, and kind of talking about it from all the different angles. But I think you're absolutely right that we need to be talking about this, and it's really important for Black, Indigenous, and people of color, BIPOC folks to recognize that it's really not even our issue, right? And I think we have been socialized to think something's wrong with us, or we need to do something different, or we have all this work to do. And we do, and that's a part of our survival that TJ was talking about, or that other people have just kind of spoken to. That is the reality. And getting white folks to understand that this is really a white supremacy issue, or the delusion of white supremacy, right, is a part of the issue. And so I appreciate that comment gave us the ability to just explicitly state that. And and I think, having conversations with other mental health professionals, teachers and schools, making sure that people understand their role in that is really important. And like was said earlier, there's a lot of resources out there for folks who have access to that. But I think you're absolutely right.
Another question was, this is sort of more related to school-based issues. How can parent-teacher associations support these efforts and hold true to their mission of promoting well-being for every student and every family in their school communities? Don't everybody jump in at once.
I think Jenny would be a good person to start with that one, and then we can piggyback.
I was just thinking through that and kind of talking to myself a little bit about it. I think that PTAs are community groups, and we talked a little bit earlier about the fact that as community groups, we have to actually do kind of the same work that individuals have to do. We have to examine the bias within how the group is organized. We have to acknowledge that probably that most of the work that PTAs have done for a long time have been focused on, I mean, I'm just going to be honest, more focused on white children and not necessarily looked at through an equity lens. And so I think that realizing within the structure of any organization, what does our representation look like? You know, representation is important. Who's on our board? Who are we consulting when we make decisions? What kind of conversations are we having? Are we actually having the hard conversations? Are we talking about not just the well-being of all children? We can't talk about the well-being of all children. We need to make a conscious effort to talk about the well-being of children based on race, and acknowledge the differences, and acknowledge, you know, where we are now and where we want to be, and start to lay out steps to get there. And definitely, as a white person, acknowledge our part in how this all is perpetuated, and what we need to do to start to make changes so that we don't continue the same cycle over and over that definitely affect our children of color in a completely different way than white children, and that the outcomes for our children of color in almost every category are not, they're not as positive, and it is a result of the bias. And I think that PTAs, rather than just having bake sales and raising money, can start, and I know that's maybe sounds a little bit negative, but I was a PTA member and I did a lot of bake sales. We didn't talk a lot about race at PTA meetings. We got to start talking about that.
Yeah. And I just want to add a little bit on there too. The question was, how do we help all of our children? I think a good approach to it is looking at the language across the board, you know, how that language is different for white children versus children of color, you know, taking a look at how you describe that child when they're in the classroom. You know, if this child is hyperactive, if this child is oppositional, you know, defiant and stuff like this. So taking a look at your language and how you portray that to the family member, you know, does that look differently for a Black child to a white child? So taking that first step to looking at that.
A follow-up to that question was, what is the best approach for the conversation about representation in a school that has a majority Caucasian students? What's the best way to approach that conversation about representation when there's very little diversity in a school or institution?
I think it has to be a true charge and initiative of the leadership at the school. You know, I think that's super important. We know that the folks that are in these schools are not really writing or composing the curriculum, right? But they are directly responsible for the administration of the curriculum and how that information is deployed to the students. And I think that when it comes to how that's done, we have the ability to really shape the narrative or the perception that goes along with the factual events or the narrative. It's one thing to just talk about something from a place of oppression, but it's another thing to correlate that to how we live today and how it's not something that we want to perpetuate, and the reasons why we don't want to perpetuate some of those negative things that may have happened, especially when it comes down to understanding that if you're in a learning environment where you're not represented with any equity at all, that element of tokenism is at play as a student. Right, and understanding what comes with that, understanding the inherent burden that the person that is feeling as if they are a product of tokenism has to go through. And I think when we have some of these candid conversations, we want to do it from a standpoint of inclusion. That's super, super, super important. We can't talk about a topic like slavery and then talk about a negative, you know, part about it, and then they say, hey, what do you think, TJ? And then everybody in the class turns and looks at me because I'm the only person that can, I guess, represent being someone who could talk about slavery, right? So I think it's just about talking about it from both sides of the coin and understanding that the person that was mentioned earlier, right, the oppressor, right, what comes with that and the negative aspects of that, I think are super important to drive home and to create equity, that's truly equity within the learning environment and in the classroom.
And I would add too, just thinking about the importance of language and really thinking about, yes, we are talking about the experiences of, BIPOC students or kids, but also when we're doing equity work, it really is for everyone. If the school environment, the classroom environment is, safer for a queer, Black, disabled child, is safer for everybody, right? If the instruction is improved so that, people are having a more rich experience, that really is for everyone. So I think that this question is really important around like, okay, looking at representation and making sure that we shift the narrative, because my liberation, it will be good for everybody, right? And we have scholarship and people, that have just kind of created that framework for us. So I think talking about equity, talking about accessibility, talking about just quality instruction and quality education and what that should be, you don't even really have to talk about race. You don't even really have to do those things, right? So because if it's just, are you reaching my child or not? Is my child learning in your classroom environment or not, right? And that's really what it comes down to. And using, I think, data. There's a lot of great, resources within the community, and a lot of folks, I think, that are doing work. If you can pull some data, talk about some of these experiences from like that perspective, and from the perspective of recruiting and retention, and looking at why aren't there more BIPOC students in this environment, that might also be, a great strategy as well. But I think it's an important thing to think about.
Thank you. Another question in the chat came up was wanting more information about some of the somatic symptoms that often people of color present when they're not feeling well, rather than talking in terms of psychological terms or mental health terms. What are some more somatic symptoms that people might present with their doctor, or just sort of feeling unwell, that you guys could share?
Some of the things that I've seen in the mental health field, I talked about a little bit earlier, is a lot of complaining of headaches, feeling of fatigue, body tightness, like stiffness kind of in your neck. We hold stress up in here, so in our back and stuff like that. So if they're talking about they're just feeling and I'm not feeling good, I've heard some people talk about too, like they're constant, their mouth is dry and stuff, and some of those signs are like anxiety, sleeping too much. They say like, hey doc, like I sleep all the time, but I'm still tired, so I don't think I'm getting enough rest, or waking up in the middle of the night, not being able to have consistent sleep, not being in that REM sleep stage. So those are just some of the things that I can think of off the top of my head that are more the physical component that they express to doctors. Any addition to that?
I was gonna take that question made me think about the ways that, not only how do we get in our bodies in terms of like the, kind of the reaction to the stress and trauma. I think we can also look at the ways that we can get into our bodies as a source of like the healing or our liberation journeys. And I think about, within Black community, for example, or a lot of communities of color, like we get in our bodies and we move and we dance, and our relationship to food or cooking, and like all of these things that we tend to do that we don't really name as like, this is the way that we survive, or this is the way that we heal. But oftentimes we're doing those things. And so if we can tap into some of those things as a resource, it can, maybe be a pathway to how we then can if we're not doing that, then it might give us some insight into, like the ways that it can show up negatively in our bodies or in our experiences, and wanted to share a resource of a person, Dr. Tama, and she has a people might have heard of her because she has a social media presence, but a lot of the works that she does, she really does embody movement and dance, and and she is a psychology like professor, and has done a lot of research related to race-based stress and trauma, and specifically like the healing elements of it. So I just wanted to take an opportunity to plug us also talking about like healing and liberation and what that can look like. And a lot of times in communities of color, we're already doing that stuff, but we just don't call it that. But oftentimes that's been a part of our survival, is through getting in our bodies and movement and prayer and all of these things that we can do, that especially if we do them in a way that's non-oppressive, then that can give us access to our healing.
If I could just add, one of the other somatic symptoms that I see a lot, or especially with little ones, is like tummy aches. My upset, a lot of times, that whole notion of butterflies or whatever is sometimes another word for anxiety. So especially young children that don't have the language to say, I have an upset stomach or whatever, but they're feeling some kind of way. And a lot of times it manifests in an upset stomach. But another question in the chat was, what can pediatricians do to support the mental health of children of color? I mean, none of us are medical doctors on this call, but I do think that maybe we can provide some insights to that question.
Can you repeat the question, Kristen? I just heard.
What can pediatricians do to support the mental health of children of color?
I would first say, take the time to listen. Like the somatic symptoms we were talking about earlier, take those into account, and help them relate that to a possible feelings of anxiety, help them relate that to possible feelings of depression. The biggest thing too, writing down what you're feeling, and then that way you can express that to the pediatrician, or write down what you're observing from your little one. What's going on in the morning, what's going on in the afternoon, what's going on in the evening. Take into account too, when they're coming home from school, are they reacting differently, or when they getting up in the morning, are they acting a certain type of way? So the biggest thing I can express is writing down those things and saying, tell them, I need you to take the time to listen to what's going on, because I'm not sure what's going on. So you as the professional, can we work together and collaborate to help support my little one or the child?
I was gonna also add, because I was thinking about this from the perspective of a person who is a pediatrician or a medical professional, and like, what can you do? And I think it's really one of the best things that we can do to support people who are trauma survivors or who are experiencing trauma, is believing them. And I think for those of us who are health professionals and educators and who interact with kids in any capacity, it's so important to believe them. And a part of believing them is recognizing that these are the realities. People are harmed in healthcare. They are harmed in mental health care. And if we can know that and think about that when we are interacting with, BIPOC folks, and not just assuming that everybody is experiencing that, but if you have an intake process, if you, if you're asking about all these other things that people might have experienced in terms of their history, can you also ask, have you had any experiences of racism or other forms of oppression that you want me to know about? Think about how revolutionary that would be if your medical doctor was like, have you experienced racism, or is there anything else that you want me to know before we interact? And we have the power to do that. We have the power to do that as educators and people who are in classrooms. You can ask, if you're a teacher, you can ask your students that, and then that way you have more data and more information. And then when you hear it, it's really important that you believe it and you interact with people as if they are folks who are trying to survive and who have been harmed, and think about that for for your students and their parents too, and all of that. So just wanted to put out a plug for those of us who have power and influence in folks' lives, is we can ask about that, and that's really affirming for folks and can create safety.
I was going to just add, don't be afraid to advocate for yourself. Don't be afraid to even bring those topics up to a professional. A lot of times we think that us as a patient, that the physician has some level of superiority over us, right? But really, this is a collaborative process. So when it comes down to the diagnosis, when it comes down to working through whatever it is, I think one thing that Tamika was speaking to earlier is really speaking to where this person is at this time when she's engaging them, and that is really the same approach that we should have when we think about a medical physician as well, is that which doctor can I have these candid conversations and maybe be able to elaborate on or even dig deep into how some of these external life situations are affecting my body and my physical health.
Thank you, TJ. One thing I would just add is that both for pediatricians, I guess, and everybody, that when you're dealing with young kids, conceptually the word racism might, young children might not really have the capacity to understand what that means. So I think for trying to communicate racism to young children as a physician or as anyone, you can talk about it in the context of fairness, because very young children understand fairness, right? And asking questions like, do you feel like you're treated unfairly at school because of how you look, or because of the way that your hair is, or because of this or that? Sometimes when wanting to get at some of these responses from young children, rather than use words like racism, which many of them maybe don't understand, talking about, fairness and whether or not they feel like they're treated unfairly for things that obviously they have no control over. Another person in the chat, when we were kind of talking about somatic symptoms, their kind of follow-up was in the same vein: what are some of the behaviors that show up for white people that are manifesting internalized racial superiority? What are some of those behaviors, just so that either people who are doing those things that don't have the awareness that that's what they're doing, or to identify them and sort of, address those in the moment?
So these are the kinds of things that I've had to really analyze for myself. And one of the things is that we think we know best, and we're gonna be the savior. And this is one of the things that I talked about in once I've identified an issue, stopping before I take action, because I don't know best. That I need to really take into account the experiences of people of color, and I don't understand those experiences at all as a white person. So that charge forward that I know best, I think, is one way that we manifest internalized racial superiority. I also think, and this is a big thing kind of in the American dream idea even, is that hard work equals success, and people who aren't successful are lazy or what have you. And it's not that simple. We don't actually recognize the privilege. We say, oh no, I worked really hard and that's why I'm here. It wasn't my privilege that got me here. But there's a lot of privilege in my life that helped me for whatever measure of success that I've had. Those are two things that have really been stark realizations for me.
To that last point around that myth of meritocracy, so to speak, or like the danger in having that is that we can start to assume the underlying assumption on that is that, folks who are poor or who don't have access are then not working hard. I can guarantee you, and I come from working class background, so I'm saying this from my experience. I know for a fact that there are folks in my family and there are friends of mine who work way harder than me and make a fraction of what I make, right? So there's a whole lot of danger in that notion. And I think I just appreciate that being an example, because especially in US culture, that notion of like pull yourself up by your bootstraps and like, people are looking for a handout, right? It does a disservice and doesn't speak to the ways that, we all, get support, need support. And, that is a huge just area, I think, because of capitalism and the way that we function. By we, I mean in the United States, like economic status and the way that we interact with people who we perceive to be inferior to us is really problematic in a way that a good chunk of violence happens for folks.
Sorry. One of the other questions wasn't in the chat, but it was in the original registration. Just sort of wanting to talk more about the impact that COVID has had on all of these issues that we're talking about, and just sort of how COVID has compounded a lot of these things, and some of the ways that we can support these children and these families in the context of COVID.
Kimberly Crenshaw, who coined the term intersectionality, I think COVID and the experiences of COVID, I think that the COVID-19 became a pandemic in and of itself is, kind of speaks to the realities of this, but intersectionality and this notion of like experiences of oppression can and are compounded by other parts of other experiences of oppression. So if you're experiencing racism and you're also, trans, or you're also, disabled, then things are going to come together, and that racism is going to hit different and, be that much more impactful. And she has a series where she's interviewing people, but it's under the Blacklight. I'll try to find it. But they are doing series to talk specifically about the pandemic and the implications of that. And it's just some really, powerful work. So I'll share that. But I definitely think that I just want to just name the ways that systemic oppression, I believe, created the pandemic, right? Not necessarily that created the virus, but we went from a virus to a pandemic. And I think that is rooted in health disparity, a lack of access to resources, the way that we have privatized healthcare that we don't even really necessarily have it, right? All of those things are working together, and just like a total lack of regard for other people and the way that we dehumanize one another, all of those things are working together to create the pandemic, because it didn't have to be a pandemic, right? Like there were systems that were in place that made it that.
Hey, Dr. Burdine, could you again name the person that's doing this work, or put it in the chat? Just someone's asking.
Yes, Kimberly Crenshaw. I'll put a link to that website. It's policy. I need to find the name of the policy forum. Yeah. Okay.
What can parents? So I think this question, it's not specific, but I think parents of any race, what can they do to reduce the likelihood of them projecting their anxieties onto their children, certainly as it relates to race? Whether you're a white parent and you're trying to raise allied children and you're worried about this, or you're an African-American parent or a Hispanic parent or whatever, and you're seeing what's going on in the world and you have anxieties about raising your child in these contexts. Like, what can parents do to not project their own anxieties onto their kids?
I think it could start very easily by just talking about taking a very humanistic approach to the topic. And what I mean by that is, as a parent, maybe just speaking to some of your personal or even inward experiences and even reservations, even if they're wrong, right? I mean, we've had perceptions of folks. We've all been products of this system, quote unquote. And so I think no matter what side of the coin that you are on, being able to speak to that kind of gives a lot of transparency. It removes judgment as well when you're speaking to a child. It lets them know that they can totally walk in the space of being vulnerable and really owning their feelings and where they are on the topic, and understand that it's something that even as an adult or as a person that's an influencer in a young person's life, that that it's still something that you continue to deal with. So you kind of take more of a humanistic approach and not make it something that you're just reading in a book, and then you're just regurgitating a fact. We're making this something that we actually live and that is a part of our fabric of our everyday lives.
Thank you, TJ. With the time we have left, I just want to open it up to a few questions that we maybe haven't addressed in their totality. If parents, for whatever reason, either don't trust a therapist or can't access a therapist or are fearful or suspicious of therapy, what are some techniques that they can use at home? What are some ways that the families can work together to help their loved ones?
Guess I'll speak from a therapist perspective. I think honestly, doing research, on a therapist, finding someone that, has some similar background or viewpoints that you do. And then, just taking the time to maybe talking to a therapist before you send your child to that. And if it doesn't work, and I hear you say, what do we do, as a parent if we don't want to take our kids to therapy? I think just having a conversation and kind of what you talked about earlier, the anxiety, letting them know like these are my feelings. I'm feeling anxiety because of this. What are you feeling? So when you're normalizing with your child, that opens up the space for them to talk about it. We do a lot of kids that have fear of, communicating with someone, doing a lot of like artwork and play therapy and stuff. And we use the word play therapy, but you as a parent can have that, sit down with your child and have that time with them, and then they feel comfortable enough to have a conversation. I tell a lot of my families to take a walk, so you're not looking at each other eye to eye. Sometimes that's uncomfortable, sitting in front of somebody and just having a conversation. So taking a walk at the park and going to get some ice cream and say, hey, I just want to check in on you, see how your day was going, how you're feeling, how's school going, how's virtual school going, how are you feeling about being home? So open up that conversation. It might take a little bit of time for them to talk to you, but I guarantee you they're going to know like, hey, my parents care, they want to be there for me to whenever I do feel comfortable enough to talk.
Thank you, Tamika. Another question is, what role can HBCUs, which are historically Black colleges, play in the fight against mental health issues in the Black community?
Huge part. I will say going to an historical Black college and university was changed my whole dynamic and paradigm when it came down to learning. It validated my experiences being in a traditional white environment of learning. And it also let me know that everything that I felt in the past was true and valid, so whatever reservations I may have had, and I was able to talk about those in a place of not being judged, in a place of identification, and you were able to be poured into and really you built upon what you felt was lacking in other learning areas and environments. Specifically, when we talk about perspective, the inclusion of your voice along the way, a big part of school in the traditional learning environment doesn't speak to the contribution of the BIPOC community. So you learn these things and you're taught these things as if you never were there, and I think just to understand that you were there and that you contributed, and in many times we're really trailblazers and pioneers in validating that is power, to understand that power that you play. And it helps you to be able to connect with that history to continue to make more history. And I think that's really what we're talking about, is the mindset of what it takes to really be a true, holistic individual.
I just want to add to that. I think that was amazing, TJ, like you saying that. I just want to add, like, we're taught to be resilient. So we keep everything inside, we keep it in the family. So educating our HBCUs about the stigma associated with mental health, and when they're provided the education, letting them know that they're more helping them, more empowering them. They're empowering themselves to reach out for support, to get some help from somebody. So and they don't have to carry all that weight on their shoulders all the time. There is somebody out there that can help them. And they have a voice, and a strong voice too. And once they feel that and know that, you can do some wonderful things.
Yeah, I'll say maybe one more point. I think one thing about, attending an HBCU that kind of you take for granted while you're there, but you realize after you have left, is that it's going to be the only time that every single one of your professors looks like you. And probably even throughout all your entire learning environment. So, the role of a teacher is so important when it comes down to the application of that knowledge in your everyday life. And when you have someone that looks like you, that is showing you the way, right? For lack of a better term, it really kind of changes the whole dynamic, of learning. Because now you are attracted to learning because you can understand the perspective of the person who was imparting the knowledge to you.
I have to speak on this as another HBU alum, but I think one of the things that I found, and this is like some of the microaggression and just like the ways that we can experience this, but growing up as a person who was a nerd, and I use that affectionately. I love the fact that I love learning. And oftentimes was like referred to as like an Oreo, or I wasn't, I was acting white or whatever, right? In the ways that we can internalize inferiority. When I went to an HBU, it was this first time that I was with other nerdy Black people, and we were Black as hell. Oh, sorry, this is a kid's pardon me, but like just that it was like, wow, you get exposure to all different kinds of Black folks. And so sometimes when people have the experience of marginalization and being in the margins of the margins, because I think sometimes you can be around all Black folks, but if you sometimes are a little different or all these things, when you go to and have the experience of an HBU, you get all of the exposure that comes with that. And that was so much of my experience that it was like, oh, wow, I was able to just like, there's people like me and we're Black and we're not going to be, othered in the way that sometimes we're othered because of our own internalized inferiority sometimes that we put on other people. So I think that that's really important. And this is also a stretch, but I just have to make a plug as a person who loves just like learning and nurturing. Also, can we as parents and people who have young folks, can we nurture people who have hopes and aspirations to go into health professions? I think it can be scary because there's not a whole lot of money associated with it, but we discourage people when they want to be teachers or when they want to be counselors and things that aren't maybe as lucrative, right? Because we're chasing after this dream, this American dream that really isn't there. It's a trap, y'all. If we can really nurture our kids to go into these fields, I think that that's, going to be great because there is a shortage. There aren't a lot of BIPOC mental health professionals. There aren't enough teachers, right? And so we also, as communities and as people who are nurturing our young folks, we have to nurture them into things that aren't just about getting rich or making a lot of money, because that's a tool of white supremacy too, right? And so I just, it's a plug, and I know it's a stretch and that's not what you were asking, but I think that that's really important, like encourage people to be mental health professionals and teachers.
No, that's fine. Thank you so much. Since we have 5 minutes left, I just want to kind of go over a few things and thank everybody for your time tonight. But if you know of a child who might benefit from talking to one of our therapists, I know that was a question that came up earlier. We do have a walk-in clinic, which is open on Tuesdays at 4:30 and Fridays at 2:30, so you don't need an appointment. And they're offered in Spanish and English, or with Spanish and English speaking therapists, so that's available. on a first come, first served basis. And you can call our main number, which we'll put in the chat for you, or visit our website. I wanted to let you know, for those of you that generously made a contribution to tonight's event, $545 was raised, and that's almost 5 therapy sessions for children. And so we just really want to thank you and let you know how much we appreciate that. These are often families that might otherwise not have access to mental health services. And so we really want to let you know how much we appreciate those contributions. Prior to the holidays, we were offering these workshops monthly. Our next one will be at the end of February. We try to put like a slightly different focus on each one. So just stay tuned for the focus for the next one, but it'll be at the end of February, and we'll make sure to send out more notices. In addition to this workshop series, we also offer, we're going to be offering a parenting workshop on this topic of talking to your children about race and racism, really for parents, and more specific information and aged appropriate information. And so those, there's going to be one offered in English and one offered in Spanish. The English version is scheduled for March 29th from 7 to 8:30. And the Spanish speaking version is scheduled for March 30th from 6 to 7:30. And again, you can find that on our website, but the workshop will help parents learn about the impact of race and racism on their child's well-being, will help parents to learn how to engage in difficult dialogues with their kids about race in a supportive and age-appropriate manner. So that's coming up in March. Letting you guys know again that this video and all of the resources that were discussed in this call will be posted on our website. And when you go to the Austin Child Guidance website, it's going to be under the tab that's called Post-Event Resources. So that's going to be up, should be up Monday or Tuesday of next week. And we've kind of got 2 minutes left. So I guess just sort of as a wrap up or as a follow up, I would say that one, again, just thanking everybody. There's a lot of other things you could have been doing at 6 o'clock on a Thursday night. So we really appreciate your time. And the other thing I would just share is that we were talking about historically Black colleges and universities. You know, I attended one as an undergraduate student. Unlike a lot of you, I am from the Northeast. So I was raised in Boston in a very homogeneous environment. In an environment that was largely Jewish. I went to many bar and bat mitzvahs as a child. Boston has a busing system where a lot of inner city kids were bused out to suburban public schools. But as an African-American child living in the suburbs, I was not one of those students bused in. So I had most of my friends and my peers lived in my suburban community. And so a lot of the African-American or other children of color who were bused out to our suburbs viewed me with tremendous amounts of suspicion and confusion, just because I really I didn't have their same experience. Mine was very different. I went to an HBCU because my parents had gone. And one of the things that I noticed first and foremost was that all the same social groups existed at the HBCU as existed in my high school, only whereas in my high school, 98% of the students were Caucasian, and in college, 98% of the students were Black, but all the same social groups were there. And I remember being so astonished by that. Why that felt astonishing, I'm not sure, but it was very validating. And I think the other thing is, for me, again, coming from a very homogenous environment in the Northeast, that was the first and only time that I was in a community that was mostly where I was not the sort of odd man out. I wasn't, one of a handful of minorities. That was the only time in my whole life where that has been the case. And while I'm comfortable, in any environment, I think that for many people, that can be really transformative. And to TJ's point earlier, can be really validating. And can answer a lot of questions that really you don't even realize you have until you're in that situation, and you recognize that it's just a very different. This is how most white people go through their whole life, being the majority in almost every context. That's how most people live all the time, or most Caucasian people live in this country all the time. And so that was really the first time I had that experience, first and only. So just sharing that personal anecdote, but We're 1 minute over, so I just want to release everybody and thank you so much. And we really appreciate all the panelists. Thank everybody so much for your time and just want to wish you a restful evening. Stay safe. Thank you.